Я дуже хотіла запросити людей поближче сюди до нас, щоб можна було легше задавати питання. And one more announcement, we do have translation into Ukrainian and Russian here. So if you need to connect to translation, if you understand English, that you don't need to have translation. But if it's better for you to go with the other language, you could connect here. And that's why we have such a lot of equipment here. And this session also will be live streamed. And I'm bringing you here closer to have the good discussion, because we will have not only presentations but also discussions.
That's true. That is very true.
It's a pity, but we could solve it. Huh?
Is it what you're thinking about? This is how you do
Women power.
Yeah, harm reduction, human rights.
A bit more.
Cameraman.
Yeah. Fine. Fine. Fine.
Is it better? Good.
Now we don't see the presentation at all.
No, we don't see the presentation.
You could stand up and speak in the microphone and see the presentation will go.
Speaking stand up.
Whatever, I assume we
А? Чуте? Слышно? Алло, 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 проверяем перевод. Checking translation. Good.
I'll just speak.
Good. So, we are starting almost in time. I'm Ganna Dovbakh, Eurasian Harm Reduction Association Executive Director, and I'm very proud to present to you this discussion, and that's absolutely honorable panel of experts in the drug policy reform and human rights. And what we will discuss today in this session, we will see actually what revolutionary, I could say, changes happened in human rights and drug policy landscape coming to the documents which we have. Before 2 years, maybe, 2.5 years, maybe a bit more, we always said rights of people who use drugs is a human rights, and then we used the general conventions. But now we have several very solid, absolutely amazing documents in the human rights world, where it's clearly said about the people who use drugs rights, about the harm reduction, about need in decriminalization. And that's so big change in our landscape that actually it's something to celebrate, but also something to plan for the advocacy actions built on these documents, built on these achievements. I wouldn't say that we really achieved the victory in the drug policy reform, and we all heard today that decriminalization, not only for this region, but for the whole Europe, is not achieved yet. But we will hear from our speakers what could be done further on. And I need to go through speakers, and fortunately, or fortunately, we have a bit slight changes in the directions of the speeches, and I hope that we will cope with this stress. And we will start with the key UN mechanisms. We're coming to you, Elina. We will start with the key UN mechanisms and UN treaties and UN instruments and tools which all our UN system have to protect human rights and to react on human rights violations on the country level. And that's why I'm coming to Elina Steinert, who is very solid and prominent lawyer from Latvia, an international lawyer and expert in a lot of issues of human rights, have been working for prevention of arbitrary detention for 6 years, and now working on prevention of tortures in different UN treaty bodies, and she's also teaching in the university. So I'm giving floor to you, Elina, for overview of the UN treaty bodies and how we could use them, because that's very important mechanism we are using very rarely.
Hello, can you hear me? Lovely. Good afternoon, ladies and gentlemen. It really is a pleasure to be here, and thank you very much, Ganna, for the kind invitation and introductions. As Ganna mentioned, I have been involved in issues surrounding international human rights law and protection of international human rights for quite some time, but most prominently, I was part of the United Nations Working Group on Arbitrary Detention from 2016 for 6 years, being also the chair rapporteur of this United Nations Special Procedure. And for the past 2 years, I am the elected member of the United Nations Subcommittee on Prevention of Torture, which is a treaty body established in accordance with the optional protocol to Convention Against Torture. So my practical experience really goes across the architecture, human rights architecture of the United Nations, in that I have been part of the Human Rights Council mechanisms, the special procedures, and now I am with the other part, the treaty body system. Now, the landscape of the UN human rights system is very vast. There are many rights, many human rights, as we all know, and there are, of course, a lot of mechanisms that have been established in order to uphold and monitor the implementation, practical implementation of these rights. There's a whole system of the United Nations special procedures, also known more commonly, you perhaps have heard quite often of special procedures, special rapporteurs or of working groups, which are these special procedures of the Human Rights Council. Now, these are usually established to either address a thematic issue or a specific right, be these, for example, arbitrary detention, torture, or address the rights of specific groups, for example, rights of women, older persons, persons with disabilities, indigenous persons. And there is indeed a great variety of these. There are 46 thematic mandates currently established by the Human Rights Council. If you look across them, it's a huge, huge variety. And there are also country mandates, country-specific mandates, of which we currently have 14 mandates. And these mandates are concerned with all catalogue of human rights, but within the context of a specific country. So thematic mandates and country-specific mandates. The unique feature of the United Nations Special Procedure System as such is that they apply to all UN member states. And this is really a significant opportunity because when, and I will talk about the treaty body system a little bit later, there you are only talking about states which have ratified specific treaties. So they have done something proactive in order to express that their willingness to be bound by a particular treaty. In case of the special procedures, this is very different, and that gives a really unique clout, an opportunity for the special procedures to engage with states which have chosen not to ratify anything at all. But the mere fact that they are part of the UN system, that they are a member state of the UN system, gives the special procedures an opportunity to engage with them, which is very unique to this mechanism. In parallel, as I already mentioned, we have the UN human rights treaty body system. And as you know, each of the we have 10 9 core treaties plus 1 optional protocol, and we have 10 UN treaty bodies which are established in accordance with these treaties. Now, these UN treaty bodies are only competent to examine issues which fall under their specific treaty. One exception to that is the treaty body I have currently the honor to serve, the Subcommittee on Prevention of Torture, which has been established in accordance with the optional protocol to Convention Against Torture, but that's very exceptional. And generally the mandate is a little bit different. But other words, we have all the 10 UN core human rights treaties which cover a whole plethora of rights. Neither the special procedures, nor the treaty body systems have a specific mandate dedicated to drug policies, which of course makes then it a little bit more difficult for civil society organizations, for other stakeholders to decide strategically, well, which body do I engage with? And the two opportunities that the various opportunities actually that these two parallel systems offer is to work on specific rights, knowing, for example, that right to health is specifically envisaged in the International Covenant on Economic, Social, Cultural Rights, gives an opportunity to engage with the treaty body established in accordance with this mandate. Equally, knowing that, for example, issues surrounding deprivation of liberty are the core part of the mandate of the United Nations Working Group on Arbitrary Detention, again opens the possibility for all the stakeholders to engage with the Working Group on Arbitrary Detention around the issues of detention as they would be pertinent in the context of drug policy, be this criminal justice issues, or be there healthcare issues, rehabilitation, so-called rehabilitation centers and treatment centers for drug addiction, for example. But of course, it makes it quite difficult to navigate because there is no that one obvious point of entry for issues of drug policy. But I would like to very much encourage you that actually it's a unique opportunity, therefore, to work with a whole plethora of different mandates on the same issues, but from different angles. So if you can't get it from here, you can get it from the other side. And this is really a great opportunity, and I would like to, from my personal professional experience, rather, with the Working Group on Arbitrary Detention, would like to give you two examples of how drug policy issues have surfaced in the mandate of the Working Group on Arbitrary Detention, which, as I said before, I had the honor of serving. So in July 2021, perhaps the learned audience already knows, at the request of the Human Rights Council, the Working Group on Arbitrary Detention published its study on arbitrary detention and drug policies. Now, this was a very big report which documented a whole plethora of issues surrounding deprivation of liberty in the broadest sense of the term, so not just criminal justice, but also healthcare settings, social care settings, and how this affects individuals and how this particularly affects the freedom, the right to be free from arbitrary deprivation of liberty. This study raised quite illuminated systemic issues, systemic instances of arbitrary deprivation of liberty as a consequence of drug policy, drug control laws, policies worldwide. This is an issue that the working group had already previously raised in various reports and various issues before, but this was the first opportunity where a specific mandate was provided by the Human Rights Council for the production of this specific, for this specific study. Because at the end of the day, arbitrary deprivation of liberty, irrespective of which context it occurs, is absolutely prohibited by international law. And I can tell you, as a person who held the mandate at the time of the study, the importance of the civil society contributions to this study cannot be underestimated. The civil society organizations, you, the stakeholders, were the ones who provided this working group with actual information as to what is happening on ground, in prisons, in police stations, in police vans, in so-called rehabilitation centers, compulsory treatment centers, where they are, and brought this important information to the attention of the working group, enabling us to analyze and to see these trends and these policies globally. And this the end result, the study which was published in 2021, I'm quite proud to report has been called the watershed moment in the whole movement of deprivation of liberty in the context of drug policies. The other example, also connected to this particular study of working group on arbitrary detention and drug policies, was as we were working on this particular report, we also noticed that it is not just detention that drug policies influence in terms of the human rights. There's a whole plethora of other rights, be these rights of women, be these rights of indigenous people to their traditional practices and crops and how these can be affected, for example, by the spraying of the crops, etc. So, in other words, there was a whole plethora of other issues which were plain to see to the working group that are affected in terms of human rights by this approach towards the implementation of drug policies. And what we did, so the report was published in July 2021, and the next year, on the 26th of June, the working group led more than a dozen special procedures in issuing the first ever statement on the 26th of June, on the World Drug Day, a statement on the negative impact of drug policies to the effective implementation of human rights. And I'm really delighted that since this has become a tradition, the Working Group on Arbitrary Detention still takes the lead, and this statement is published subsequently every year on the 26th of June, which is, again, a fantastic way of galvanizing the attention of the world as to just how widespread, how many different aspects of human rights are negatively, adversely impacted by the drug policies and the various ways of how they are implemented worldwide. Now, of course, the whole architecture of the UN human rights system is not easy. And again, I say it again and again, the fact that there is no special rapporteur on drug policies or one convention on human rights of persons who use drugs makes these entry points perhaps not so obvious. But there are plenty of opportunities that the UN system offers. And I shall be delighted to discuss them more with you as we have a workshop this afternoon. So please, if I may finish on this little note of advertising, please come and join our workshop later. Thank you.
Thank you very much, Elina, and we are very happy to have lawyers who could professionally advocate and professionally protect our rights on the different levels, not just the lawyer who are protecting in the court, but lawyers who analyze the situation and doing the important report we could rely on. And we will discuss the submissions and examples of country submissions this afternoon. And I am moving to an interesting angle of the human rights. We're always saying violation of rights to health, it's when the people who use drugs not receiving services. But why they are not receiving services? Because the services are not funded. In the same time, states always saying to us, there are no funding. But when we are comparing, once we did, not even once, we are doing every two years in Eurasian Harm Reduction Association comparison of cost of state which is paid for criminalizing people, for keeping them in jail, and this funding always available, and they could be 10, 15 times more in comparison with providing a person harm reduction, opioid agonist treatment, and unemployment benefits. Altogether, it could be 15 times less than keeping person in prison. So for this, states always get funding. But the ironic, the very bad ironic situation is that even the aid budget, the inter-country budget, international budgets, international donors for declaring the public health budgets, they are also investing in war on drugs. Am I right, Catherine? And I'm giving the floor to Catherine Cook, our absolutely amazing colleague from Harm Reduction International, who is doing for decades, doing in-depth analysis of the funding and lack of funding for harm reduction. That's usual stuff. But this point that European Union and the biggest donors of the humanitarian response, they're spending money and they're supporting war on drugs. The floor is yours.
Thank you, Ganna. Really happy to be with you all here today, and to be on this panel of amazing people talking about human rights. I have some slides, so just to introduce myself while the slides are being prepared. My name is Kat Cook. I work at Harm Reduction International. As Ganna mentioned, part of my role is to track harm reduction funding in low and middle income countries. I have also done work with some of you on tracking it within the European Union, but the funding at the moment that we have is focused on low and middle income countries, so that's where the research is at the moment. You can go to the next slide, please. So just to say that, oh, thank you. Great, thank you very much. So my colleagues, Gaj Gurung is also at Harm Reduction International and worked with me on this piece of work, but we had an amazing investigative journalist working with us called Claire Provost, who is a follow the money journalist, so we were really lucky to be working with her on this. So before I talk about the money that donors are spending on punitive drug approaches, I just want to share the latest headlines from our research on what is invested in harm reduction in low and middle income countries. We all know that harm reduction funding is in crisis, and in 2022, funding from donors and governments was just 6% of what UNAIDS estimates to be required in low and middle income countries. All of us here know that harm reduction is rooted in promoting health and human rights. It contributes to the Sustainable Development Goals. It prevents HIV and hepatitis. And as such, it is a legitimate use of aid funding. And yet, donors provided just over 100 million in funds for harm reduction in 2022. So not a huge amount by all accounts. In contrast, governments and donors spend vast amounts on punitive drug approaches around the world. Since 2015, many of us in the harm reduction sector have been highlighting this imbalance in drug policy spending and calling for governments and donors to look critically at their budgets, to really look at what they're achieving with their spending. I mean, we know that the idea of a drug-free world, which some of the governments are trying to achieve, we're further away from that than ever before. We really want to see a redirection of these investments into drug responses rooted in communities, health, and justice, so that they're funding things that actually work. So the damage that the global war on drugs has caused won't be news to any of you, but it is interesting to note that, like in the documents that are being highlighted today, you know, we've also had the World Bank report call the war on drugs a strategy that's repeatedly failed. We had a European Parliament study calling it ideological. A UK aid-funded research described it as counterproductive with potentially disastrous consequences for some of the world's poorest. The evidence base is now really wide indeed that punitive approaches to drugs fail to reduce drug use, but succeed in perpetuating human rights abuses and impeding public health responses. We also know that globally, punitive drug control upholds racist and colonial structures. Marginalized and racialized communities, including indigenous peoples, are disproportionately targeted and affected by punitive drug policy. So at HRI, Harm Reduction International, we wanted to know a bit more about how these international funding flows were supporting the war on drugs. And early on in our investigations, we discovered, and it was a bit of a surprise to be honest, that aid budgets were a source of funding for punitive drug control. This seemed to be an unusual choice for budgets that are intended to support poverty reduction and development goals. So we've published a report, and you can see the cover of the report there, in late 2023, and the research was based on analysis of data that donors themselves report to the OECD, so the Organization for Economic Cooperation and Development. The OECD currently sets the rules on what kinds of spending donors can count as aid. And this includes narcotics control, and that is an official subcategory of eligible aid spending assigned the sector code 16063. And it covers a range of activities which are all aiming to restrict narcotics traffic and distribution. But this subcategory wasn't always there. It was introduced in the 1990s when there were a number of changes made to include spending on global issues, including the environment and peacekeeping, to maintain the relevance of aid. Our research found that dozens of donors, led by the US and the EU institutions, used their aid budgets for narcotics control activities in the decade from 2012 to 2022. So we found that more than 974 million, so almost $1 billion US dollars of aid money was spent on narcotics control projects in countries around the world in that 10-year period. And the US tops the list with the most money spent on narcotics control, followed by the EU institutions, Japan, the UK, Germany, and Finland. Overall, dozens of donors have used at least some of their aid budgets this way since 2012. And there are transparency gaps on how the funds are being used, quite a lot of transparency gaps as it happens. And there are activities that look like they are not terrible, and they could also be coded somewhere else under other sector codes that would be more fitting. But there are definitely activities supported within this narcotics control budget line that undermine development goals and go against the do no harm principle of aid. So some examples of those things would be upscaling airport controls in Bolivia, enhancing intelligence-led profiling of passengers in Colombia, supporting surveillance capacity of the Mozambique Intelligence Service, polygraph training in the Dominican Republic, undercover police training in Peru, sharing skills, experience, and training on counter-narcotics with the Brazilian Federal Police, law enforcement support for the fight against drugs in Peru. So all of these things are quite far from what most people picture when they think of aid spending and beneficiaries of aid projects. Looking a bit more closely at the European spending, recent European spending, you can see that the EU institutions are the top of the list. And as you saw on the slide before, they were the second largest spender over the last decade. But in several specific years, the EU institutions actually spent more aid like this than the US. So in 2016, for example, they recorded $55 million for narcotics control versus just 16 from the US. Looking at this recent data, there are a couple of trends that are emerging. So you can see here that EU institutions and some European governments, including Germany, Portugal, and Switzerland, have increased their narcotics control spend, while others report no spending for 2022 or some years before that. And the OECD database is quite difficult to navigate, but it does contain microdata with more details. And yeah, as I mentioned before, there's transparency gaps. So we are sort of trying to figure out if there are more transparency gaps for this particular line than many others, and it does look that way, that there's actually a bit of secrecy around what's being spent on this line. But we can see that most European aid was spent in Latin America and Africa. And some examples of the EU institution aid that was spent on counter-narcotics projects in West, Central, East, and Southern Africa. There was one for 43 million spent on a multi-year project to support Nigeria's efforts in fighting drug production, trafficking, and organized crime. So while the amounts of money dedicated to narcotics control are small shares of overall aid spending, they still rival or exceed that dedicated to other things. So for example, in 2021, more aid was spent on narcotics control than on school feeding, labor rights, mental health projects, and it didn't even make it onto the graph, but there is a sector code slightly strangely named Control of Harmful Use of Alcohol and Drugs, and that only had 25 million over the decade. And that's where you would expect things like harm reduction, definitely drug prevention stuff to go, and treatment. So part of the other tracking work that we do is to look at where countries hold the death penalty for drug offences around the world. And the latest research that we released on this in 2023 found that there were 34 countries around the world that had the death penalty for drug offences, despite this being against international law. So this map shows the recipients of aid for narcotics control in the light blue, and then in the slightly darker blue, you can see those countries that also have the death penalty for drug offences. So this clearly raises some particular serious concerns about whether aid budgets have bolstered regimes that execute people. And while it doesn't look like the European money is going, we can't kind of see a direct relationship between the European money and that particular issue. We do know that in 2021, US aid went to counter-narcotics training program in Indonesia, where that same year a record of at least 89 people were sentenced to death over drug-related offences. And between 2012 and 2019, some Japanese aid went to support counter-narcotics activities in Iran, which in 2021 executed at least 131 people for drug offences. So the negative consequences of punitive approaches to drugs on human rights and health have been extensively documented. They've included mass incarceration, discriminatory policing, extrajudicial killings, torture, and the use of the death penalty in some countries, forced treatment, poor farmers' livelihoods being destroyed, and disproportionate harms to people of colour. as well as stigma and discrimination that threatens access to services. We know that everyone, without exception, has the right to life-saving harm reduction interventions, and that's what a group of UN human rights experts in 2022 said when they called for the end of the war on drugs and the promotion of policies rooted in rights instead. Harm reduction interventions seek to mitigate negative health, social, and economic consequences of using drugs without necessarily ending drug use, and that seems to be a much better fit than narcotics control for spending from dedicated budgets that are supposed to help poor communities and development goals while doing no harm. Our report argues that donors should divest from punitive drug responses and invest in harm reduction alternatives and other things that are rooted in community health and justice. The aid system must be more transparent and accountable to its core purpose to support international development while doing no harm. We do need more research to delve into the use of aid funding at country level and look at the impact that this has had. And I should just advertise, we have a report coming out on Wednesday, which none of you will see because you'll all be here, but it is going to be recorded so you can watch it afterwards. It's a report looking at the US funding, not just from aid, but extensive funding from other budgets too, on the kind of war on drugs around the world. But we do need more research. And we also concluded that there's no place for narcotics control in the future of aid, and that the OECD should consider whether this should be removed and not used as a sector code at all. Just as I'm finishing, from an advocacy perspective, this has given us an opportunity to get a bit of media attention for related to the harm reduction funding crisis. Generally the media is not interested in harm reduction funding, but when we started talking about taxpayer money going to things that most people could see as being not quite right, that got us media attention. So we had an article in The Guardian, which was great. It also meant that we talked to new people, aid accountability organizations, development sector organizations that didn't necessarily know about drug policy and harm reduction so much. So for us, it's been quite a good opportunity to get outside our bubble. And we really want to keep furthering this work. If you want to know more about the Divest Invest campaign, you can go to Invest in Justice, and there's just a couple of links there for the report and some more funding stuff that we're doing. Thank you very much.
Thank you, Catherine. And this is the exact what I'm afraid every time when I see the program, European Commission program of cooperation with the countries, let's say Central Asia country. Always when they say training, I'm afraid that they are training the sniffing dogs, but not the people about public health. And that's I guess I have now more background for believing in this, or training, I don't know, pilots of the searching drones for catching up people, but not about providing help in naloxone. So that's very worrying situation. And with this note, we are moving a bit more to east in central, from the broader Europe to see what is happening with human rights, and specifically not only right to health, but to a lot of different rights we always ignore when we are speaking about the human rights of people who use drugs. We are always saying right to health, but it's not true. There are plenty of rights which are violated by implementing the war on drugs. And I will give the floor to Magdalena Dobkowska, who is from Helsinki Foundation for Human Rights, Poland. And she will present absolutely amazing report with the good cause, actually. And we developed this purposely and collecting data on the violating of human rights in our region. Thank you.
Thank you very much. So if I could ask for my slides. Hello everyone, my name is Magdalena. As mentioned, I work here in Warsaw in Helsinki Foundation for Human Rights. And before I move to the region and dive deep into the topic, I just wanted, for the sake of understanding and not to bore you with the basics, to ask those of you who use human rights in your everyday work, like human rights mechanism, either at the country level, at the UN, any submissions, knocking on the door of the ombudsman, etc. Could you please raise your hands? Thank you. And those of you who feel you know a lot about human rights? Okay. The last question, who feel that know a lot about human rights, that you know the human rights conventions, etc. Okay, thank you. So in that sense, let me see if I can at least, yeah, the panelists. That's it. Okay, so very basically and quickly about the basics of the human rights protection system. I really encourage you to visit the webpage that was created at the celebration of the 50th anniversary of the system. It's been a few years ago already, but I believe that materials that are there are really reader-friendly and quite short, and they might be very informative. Because we have all heard a lot, I believe, about the 3 drug conventions that clearly impact people's lives and our everyday work. But there are also, as you've heard, at least 9 treaties, they are human rights documents. But if you don't feel, I mean, I don't want to discourage you, but if you feel it's too advanced to read the 9 of them, just make sure you go through the 3. We've got the Universal Declaration of the Human Rights, and on the basis of that, 2 treaties that list the 2 covenants that list 1 civil and political rights. Okay, I'm so sorry. I had too much sugar for the lunch. And the other one that covers economic, social, and cultural rights that I will be referring to today. And the 2 documents list the human rights that everyone is entitled to. And I really want to say it slowly and loudly, everyone is entitled to. Human rights are embodied in the fact that we are human beings. And no circumstances, nothing can deprive you of these rights. They may be violated by the states, but remember that you always have them. Everyone always have them, regardless of what the drug conventions force the states or the states choose to do on the basis of them. And here is the list of the rights. On the left column, the civil and political rights, and on the right column, the economic, social, and cultural rights. And I need to admit that we as human rights defenders often focus on the left column, on the civic and political rights. And when you look at the list, you will understand why. You will find the very basic rights there, like the right to life, freedom from torture, etc. So it is understandable. But at the same time, when you look at the right-hand column, you will see that economic, social, and cultural rights are actually those that cover each corner of our everyday life. You will find that the right to family life, to housing, to employment, to social security, to education, and to health, as it was mentioned, and many others. So actually, all the levels of everyone's life are covered by these ones. And it was 2 years ago when the Committee on Economic, Social, and Cultural Rights, so the UN body that oversees and monitors to what extent states actually protect those rights, how they fulfill the covenant, the committee announced they may create the general comment, a kind of a guideline for the states, focused on drug policy and how the policies and the laws and the implementation actually violate, or to what extent it influences the possibility of people to enjoy the rights, the economic, social, and cultural rights. And it was the moment when civil society around the world came together thinking, okay, we need to do something to make sure that if the general comment really is created, it is fed with the up-to-date information from the ground, from the stories of people's lives. And this is exactly, as Hannah mentioned, when Helsinki Foundation and EHRC decided to join forces And we held together a number of civil society consultations in the region, 1 in person, 8, I think, online meetings, where we gathered civil society representatives from 19 countries of the region, drug policy advocates, harm reduction providers, community members, people who live with HIV or AIDS, who use drugs, etc., to consult and to hear their stories. And then we also did a bit of a desk research. On the basis of that, we collected the huge material. The report is being prepared right now. It's going to be a long one. The material, as I said, is huge. The summary was already submitted to CESCR, to the committee. It was presented at this year's session of the Commission on Narcotic Drugs, and it has already informed a number of UN submissions. And today I wanted to say what we found, so I'll keep the list of the rights visible to you. So we identified, of course, significant barriers to the realization of the economic, social, and cultural rights. And it will be no surprise to you when I say that the criminalization of drug use emerged as a cross-cutting issue that really exacerbates existing challenges in relation to all these rights. Laws that penalize possession and use of drugs for personal consumption, and this is what usually happens in the countries of the region, reinforce stigma and discrimination and create significant barriers to accessing essential services such as healthcare, social security, and employment. We mentioned the healthcare, and this is the right that usually pops up as the first one when we think about economic, social, and cultural rights, as Ganna rightfully said. And it is clear to all of us why. Because drug use is a health-related issue, so we all know that also that access to harm reduction in the region is very limited, not only in this region, but this is the case. When you think about opioid agonist therapy, it is still banned in Russia and in Uzbekistan. In many countries, it is non-existent in prisons, in some even in hospitals. The way the OHCHR programs are created, not allowing for take-home medication, for example, prevent a lot of people from really leading a normal life and obtaining and then maintaining their employment. So there's a lot that can be said about OHCHR, about harm reduction, about access to AHV, but these are not only these issues. And again, there are also groups that are doubly targeted, I would say, by the violations, for example, women. We are also talking about the violation of their or our reproductive rights, especially when you think about women who use drugs. It may have the form of even the trials or really done forced abortions. This is about access to contraceptive services, to anti- and postnatal care, antiretroviral therapy, prevention of mother-to-child AHV transmission services, and many others. And the situation even worsens when we look at women from Roma communities. This is the minority in the region that is also, again, doubly or even third layer targeted by the violations. I mentioned abortion, the forced abortion, the trials to do so, which takes us to the family lives and how you can be deprived of your parental rights if you are a person who is identified as one that uses drugs. You can even lose the right to have your child with you. I mean, there are places when parental rights may be terminated for parents who use drugs, either according to the legislation or actually just based on the practice and not rooted in the law. In Belarus, for example, if one of the parents at least uses drugs, the child can be taken away and put into institution, into orphanage, and then parents have to cover the cost of the stay of the child. So it's not only separation, which is horrendous, and to me as a mother, difficult to imagine even, but then also you need to pay the costs. One of the interviewees in Poland who works in the harm reduction service also shared the story when a child was taken away from mom right after the birth, right after she gave birth in the hospital because she was an OIT patient. which is not a legal basis in Poland to take the child away, but because doctors were so uninformed about OAT, because they were so worried, they put the whole procedure, and it took 3 months to get the child back to his mother. So awful stories do happen. When we think about the right to the family life, also thinking about women, mothers who are exposed to the family interfamily violence, simply by the fact that they use drugs, they are sometimes, or quite often actually in the region, denied access to shelters. So we are moving right now to the right to housing and to the conditions of our life. Again, in many places, the fact that you have a history of drug use actually prevents you from using shelters. It sometimes differs in places regarding whether you're a so-called active drug user or in treatment, but in other places it doesn't really matter. So people have simply no roof on top of their heads. In Hungary, for example, it goes even further. The constitution bans and criminalizes homelessness. So meaning sleeping on a street is a criminal offense. At the same time, the state doesn't provide enough places in the shelters. So it's like a limbo. So we do have all those situations. Again, prisons, the overcrowded prisons, I think about like the roof on top of your head. Some people end up imprisoned, and again, this is the circumstances where they cannot access the right conditions of their life, the right conditions of healthcare. I'm quickly looking at my numerous notes just to share maybe a few more examples that would be illustrating, as I said, how each single corner of the life can be influenced. I haven't still mentioned the right to work, and then probably I should stop because I could continue and continue and continue. So again, in many places, if you are perceived to be a person who uses drugs, or if you are an OAT patient, you may be excluded from employment. You may be either by the law or by the practice subject to drug testing or AHV testing, and again, it brings the possibility you will lose your job. As I mentioned, the way the OAT are designed prevents a lot of people from going to work on daily basis. If you're not employed, then you cannot access the social services quite often. Even the health insurance, in many places, it is connected with the employment, with the official employment. So if you don't have a legal job, then you actually cannot access healthcare services. So there's more and more on that. It relates also to education, to whether kids, even kids at the age of 16, as far as I remember in Hungary, can already be kicked out of school because of drug use. Sniffing dogs are allowed, testing is allowed in many places, I mean like students testing, then you've got universities. So really when you think about like everyday lives of people, when you think about your life also, like when you go to the job, or then when you go to meet your family doctor, or your kids go to your school, etc. Each of these layers could be influenced by how the drug laws are created and then also enforced. And on top of all of that, we have the criminalization. So it's not only stigma, it's not only the fact that you may be using drugs. In addition to that, if you have ever been convicted, you also have the criminal record, and again, it influences all those areas. You may have difficulties obtaining the job because you've got the criminal record. You may not be allowed to adopt children because you've got the criminal record, etc., etc. So it can go over and over, and it was really striking to me to see how many violations there are. That on one hand, we may say, we've known about them. It's not that we found out new things, but how they piled up, and actually how wide range of them we discovered. That was striking to me, and I realized also as the human rights person that we really need to focus way more on social, economic, and cultural rights. And I'll be just showing one last slide, I promise. I'll skip this one, unfortunately. But I would like to finish with a call. I understand that people who provide harm reduction, who work in the communities, I am fully aware that you've got hands full of work. This is completely understandable, and I have a lot of respect. But if you find a tiny bit of time and energy, please do document people's testimonies. The stories have a huge power. We've heard a lot about numbers. We've heard a lot about the strategies, the documents, the decisions that stay on paper, but I believe and I've observed that sometimes the human story can have a lot of power. So if you have the possibility, document the testimonies, collect data. If you find even more time and energy, try to make your own submissions to different UN mechanisms. There will be the workshop today about that. We're happy to help as well. If you don't feel like doing it, at least share the stories with us. We may also try to make use of them. Then when there are reports coming, like when there are outcomes of this work, make sure to use them at the country level. Make sure you keep your governments, local governments accountable, and whatever recommendations they receive from the UN bodies, this is our job also, to point to them each time and to ask, what have you done about it? And for all of that, I invite you to stay in touch, and I can see Ganna's face already. Thank you very much.
Magda. And actually, it's very good to have the proper human rights agencies with us, because that's the global shift which we have now. Finally, we have Helsinki Foundation with us, we have Amnesty International with us, we have Human Rights Watch with us. So that means that we are not marginalized with protecting rights of people who use drugs in the global human rights perspective. That's also important shift. And with the Eastern Europe and Central Asia, if continue with this sub-region, we do have a system we dreamed of already in a couple of countries with the paralegal and legal support, and with the proper documenting and setting the whole system of documenting and verifying cases of human rights violations. And in this point, Alliance for Public Health and Victoria Kaleniuk personally, as an expert in gender and human rights in this organization, play a very important role. So they did the system of documenting, monitoring human rights, but also together with other initiatives in human rights, we are embedding together the legal services as a component of harm reduction. And that's important part, because people telling their stories not only, but usually not only for bringing them to the UN agencies and speaking about their rights, and maybe possibly in couple of decades to have some written changes in the law, but they want to be supported right now with this violation, with this barrier. Vika Kaleniuk, proszę.
Yeah, thank you. I have my presentation. Kindly switch on, please. Yeah, thanks. Okay. So I'm coming directly from Ukraine, and I would like to dedicate my speech to the Ukrainian defenders who continue to fight against Russian occupiers, giving me a chance to live and to participate today in this panel. Also, I express my heartfelt support for people in Sakartvelo who are now standing up against pro-Russian and undemocratic direction of their government. So I began my speech with political statements, because in our daily work we witness how destructive trends in politics and legislation negatively impacts people's lives, particularly those who are the most vulnerable to HIV and are the most marginalized. Autocratic and inhuman approaches, often backed up by Moscow, are poisoning Central Asian and Eastern European regions and hindering progress in public health. In recent years, we have witnessed a parade of undemocratic changes and legislative initiatives across various countries in the region, aiming at suppressing civil sector and narrowing the space for activism and advocacy for communities and activists. So in 2012, Russia adopted a foreign agent law. This year, identical laws have been adopted in Georgia, in Kyrgyzstan, and moreover, we are seeing similar legislative initiatives aligned in spirit and purpose emerging in Europe as well, in Hungary, in Slovakia, and in Bosnia and Herzegovina. Notably, drug policy and harm reduction often become tools in political power plays. Whenever governments lean towards autocratarianism, we immediately observe an increase in police persecution of people who use drugs, along with a decline in quality of health care. In most countries of EHRC region, OST coverage is very low and does not respond to the actual needs of people who use drugs. Existing drug users registries in most countries of EHRC region create a high barrier in accessing life-saving treatment. In Georgia, take-home dosages are now not possible anymore, even though during COVID times it was accessible. In Kazakhstan, the pilot program of OST treatment is under risk of closure because a group of opponents has been actively campaigning for its closure. However, in Kazakhstan, government has currently decided to continue OST program after urgent country visit of EHRC Drug Policy Commission. So now I will present some data and statistics to provide more clear picture of what happens on the ground. The data presented here was gathered by communities and represents the real situation and the tip of iceberg of human rights violations. And this is just a part we managed to document. Today I'm speaking here on behalf of vulnerable communities who cannot openly advocate for their rights due to risks of persecution and discrimination they can face from their governments. So the resource of data presented here was documented through the biggest CLM tool used to document and, importantly, to respond to human rights violations, discriminations, stigma, incidents against vulnerable to HIV communities. This system was introduced in 2019 in Ukraine, and now this tool is operative in 14 countries of EHRC region and unites more than 270 NGOs and community-based organizations in the region. Since 2019, we have documented more than 27,000 cases in the region. So what the data says? People who use drugs are the second largest vulnerable group whose rights are most frequently violated. The number of documented cases in each country highlights frequency of rights violations of people who use drugs. However, it also reflects the scale of documentation process. For instance, the chart shows a high number of cases in Ukraine. This is partially due to the war, but also it is because a big scale of implementation of this process. Over 60 NGOs participate in documentation process in Ukraine, comparing to Uzbekistan, where just only one organization is able to do documentation and responding to human rights violations. So the law enforcement agencies and healthcare workers are the primary violators of the rights of people who use drugs. Interestingly, in more democratic countries like Ukraine and Moldova, Most reported violations involve healthcare sector. This is because people who use drugs feel safer seeking medical help, they understand their rights to proper services, and they recognize that stigma and discrimination are unacceptable. Meanwhile, in Central Asian countries, the majority of cases highlight ongoing persecution by law enforcement agencies. In Moldova and Ukraine, common complaints concern the quality and accessibility of OST treatment. In contrast, in Uzbekistan, such therapy is entirely unavailable, and instead, people who use drugs face near daily harassment and blackmailing from the police. So, the main types and the most common incidents of human rights violations we have documented against people who use drugs are intimidation, threats, blackmailing, hate speech, police abuse, abuse of power by police, extortion of money and bribes, refusal to provide OST treatment, illegal detention, humiliating treatment during staying in medical institutions, refusal to provide hospital care and emergency support, and more types of different rights violations. According to our information, every person who used drugs has an unpleasant experience with the police at least once in their life, and they are unlikely to turn to police when some crime happens or when their rights are violated. Moreover, 1 in 3 detained drug users has been subjected to tortures or cruel treatment during detention. This is most commonly seen in police using force to extract confession, even for crimes that detainee didn't commit, as well as intentively holding them in detention to restrain access to OST and induce withdrawal syndrome, all with the aim to pressuring the detainee to confess crimes and to take the guilt for the crime which was not committed by this detainee. So, in contrast, I would like to give some example of Ukraine, which, despite resisting to Russian occupation, continues to provide services to vulnerable groups. In particular, during the war, the dynamic of enrollment of patients into OST program continues to increase. This year, our government legalized medical cannabis, and the new national strategy, drug policy strategy is under development, and we really hope that more human and more progressive approaches will be implemented within this strategy. Though, as in conclusion, I would like to emphasize once again that autocratic regimes restrict human rights and harm essential backbones of health-related response for people who use drugs, such as civil society, community, OST treatment, harm reduction. This fuels new HIV infections. Ukraine has shown the regional way to open-minded, community-driven, person-centered and innovative programming, which have led to controlling and reducing HIV epidemics among people who use drugs, including in the war situation. Let's choose the right direction.
Slava Ukraini! You don't know how to respond. You need to say Slava Ukraini and then Героям Slava. Oh, now good. So we saw all the questions on how we are trying to document the human rights violations to reduce harm from criminalization and to reduce harm for activists, of criminalization not only people who use drugs but also activists. And now the floor is yours, guys. So you have the floor for questions, clarifying questions or comments. Please raise your hand and we will come with the microphone, because as we have translation here, we will need to speak in microphone. Who have the first question or comment? Please introduce yourself when you're speaking. Thanks.
Hello. Oh, it's working.
Hi, my name is Lauren. I'm from the United States, and I wanted to ask about the human rights violations that the UN is tracking. And of course, in the US, we have criminalization and a raging war on drugs. And I'm curious how the UN can hold like the United States accountable given the amount of funding that comes and what kind of complexities come with that for members of the UN that are providing significant amounts of the budget for the UN, and how that works with large states like the United States.
Could you clarify the question? It's about the funding from US, or it's from the human rights within the country?
Well, from what I've known about some of the history with the US and the UN, they provide a significant amount of the budget and sometimes can use that as a kind of way to influence. And so I'm curious if that has been able to, has the UN been doing anything with these human rights violations related to the US's war on drugs, or is it complicated by the US's role in the funding?
Okay, that will be question. We have a bit creative approach to the session, and Zaved will respond it with the all like summarizing questions. Could we? Because that's important point with the U.S. support to the not only human rights but all development aids, and that's for us is very crucial and crucial data about supporting our advocacy as well. So I guess that part is very important. Any other comments and questions, and maybe examples from your country, what you could do and what you are already doing in protecting human rights and this shift in the paradigm in your dialogue with the authorities? Please share. If you will speak Russian or Ukrainian, I will translate. No comments. No, impossible that you don't have comments. Yeah, we have.
I just have a very quick clarifying question for Victoria. You said 1 in 3 detained people use drugs are subject to torture or cruelty. Is that globally or in European countries? Just quickly.
I hope I heard correctly the question. So the information I possess and I presented today was regarding EHRC region, so 14 countries of Eastern Europe and Central Asia and Southeast Europe. So that data we possess and we can analyze. I believe that the similar incidents happen all over the world. The question is, can we document these incidents and can we have this information as an evidence? Moreover, it's important to emphasize that none of that cases were somehow resolved. No one was punished. No one was prosecuted for such treatment. So it's quite complicated to collect this evidence and to support individuals in these situations because they do not believe in judicial system and they don't want to go to the court and to claim for justice. And that is why we have such a few evidence about these incidents happening.
And sometimes it's even dangerous to go to the justice. So that's why all key populations like sex workers, LGBT, and people who use drugs avoid of doing this. And that's why we are speaking not only about legal services in this region, but paralegal services, when peers could consult and report and help, maybe not obviously go to the court, but to mediate the cases and to try to overcome the challenge, even though the system is not changed. Any other comments and questions? Because we do have time for you. Oh, yeah. Yeah, please, Elena.
Sorry, I just wanted to just jump a little bit at the back end of what you just said in terms of addressing the occurrences of torture. I think what is also very important to talk about prevention of torture in the context of drug policies as well. And this is where, if I may very briefly come back to the mandate of the Subcommittee on Prevention of Torture, which is a little bit different body. Instead of addressing occurrences of torture, what our mandate is to look into the what mechanisms and what checks and balances can be put in place in a country to ensure that it doesn't occur in the first place. So it's about the prevention. And on domestic levels, countries which are parties to OPCAT, to Optional Protocol Convention Against Torture, are obliged to establish the national preventive mechanisms. And the essential mandate of these national preventive mechanisms is to carry out regular visits to all places of deprivation of liberty in order to see how people deprived of their liberty are being treated in these places. And of course, again, with the prevention in mind, the idea is that this regular visiting, opening up these normally closed facilities to this independent scrutiny would minimize the risks of torture. Thank you.
Thank you very much. Any other comments and questions? Something came to your mind thinking about the human rights and some challenges? That's a unique opportunity to use the expertise from, there is the question, the expertise of the panel.
I'm Imani. I work for an association that is made out of people who use drugs and advocates for the rights of the people who use drugs. We also work in prison, and we're in Italy. We're based in Turin in Italy. There's a security bill that's being passed in Parliament in Italy at the moment, and some of the things that are coming out to us who don't know very much about the legal side of human rights seems to be very much in violation of human rights. What do you do when you think something is not right?
And could you describe a bit what is in this law? What is
For
what
example,
you feel as a violation?
At the moment, women who are pregnant or who have just given birth do not go to prison. They've used a motivation saying that Roma women use this as an excuse not to go to prison, and they are putting forward this bill so that pregnant women and women who have just given birth are in prison, are put in prison, for example.
Oh, sorry.
No, I mean, I know very little about the human rights protection system in Italy, but I would go like, first, in many countries we have like ombudsmans for human rights. This is the person usually nominated to collect information, intervene if possible, also very often at the legal level as well. I don't know how it looks like in Italy. In many countries, in this particular case as well, like the ombudsman specifically for like patients' rights would be also the address. If you feel that your organization doesn't have the capacity, the knowledge, the legal expertise, then usually there are also other human rights organizations like NGOs that can also support you. And we've got the international level, like the UN. Well, we've heard about EU a lot today in the morning, that it's becoming less and less supportive, unfortunately, when it comes to human rights. I mean, declaratively, yes, but then in practice it looks differently. But I also leave it to colleagues from the UN bodies to share about how the UN system could be supportive here.
The obvious example that straight away comes to mind is the Special Rapporteur on Violence Against Women and Girls in this particular situation. And because this is a special procedure, so Italy would be subjected to that because it's part of it's one of the UN member states, obviously. In case of legislation, there is a possibility for the Special Rapporteurs to issue urgent, what is called other letters, which instead of addressing a situation of a concrete individual, addresses a legislation. Now in this case, as a civil society organization, you would raise the issue with a special rapporteur, who would then hopefully take up the case and write a letter, initially confidential letter to the government of Italy, outlining the concerns around the law and how these particular legal provisions are breaching Italy's obligations under international human rights law, and the government would be requested to respond to the special rapporteur usually within 60 days. That would be the one concrete mechanism that could be engaged, but depending on what it is, it's a minority issue as well. So there's a special rapporteur on the rights of minorities that could also be engaged with this, and there is nothing wrong with using both of these mandates in order to advance the particular issue.
But the first point for any fight like this, that's the good description what you feel as human rights violation. So even when it's legislative initiative, you could take, it's not implemented yet. All human rights agency will say, if it's not implemented, we don't know if it will violate your rights. But if you describe what is written there and describe previous practice and have the clever sign that something wrong, that's important to get. And here in the conference, you have plenty of human rights experts who need to hear from you and to understand what is the specific language and what are the rights which could be violated or could be at danger. At least for me, as not lawyer, the first step was always like to try to describe what is, no, I'm not lawyer, I'm psychologist. So the first was to first describe, to hear from people, especially from community, what is wrong, then to describe in the human language properly what is wrong, how do you feel this wrongness and unjust, and then to ask lawyers to write in their language. And yes. Yes, if it's a big bill, then to take all the points and then ask lawyers to redirect these issues to the conventional language, because they have very specific language, believe me. So, thank you. Do you have any comments? Yes, please. Person who knows specific language.
Yes, I'm Denis Hubert, the Executive Secretary of the Pompidou Group, and I already mentioned this morning at the European Policy Dialogue the fact that the Pompidou Group has adopted a policy paper on human rights and drug policy. And as you are mentioning the importance of translating a political document into a legal document, this is exactly what we are now aiming to do. We have a policy document, which is a political document, and we will now launch a process to work together with the Specialized Expert Committee on Human Rights of the Council of Europe, the CDDH, and we will prepare a draft recommendation for the Committee of Ministers of the Council of Europe, which will be the first ever international law document in the field of human rights and drug policy. So that's our next target, and of course we hope to succeed. It should be possible to finalize this towards in 1 year time, or maybe sometime in 2026. But I think this is very relevant for this panel. You can find the current policy paper, which is a political document, on the Pompidou Group website, so you can have a look at it. And indeed, someone mentioned sorry, I had to grab my paper. And indeed, someone mentioned that when we speak about human rights and drug policy, it goes much beyond only the right to health. And this document makes a list of all human rights which are at stake. The right to life, the right to health care, the prohibition of torture or inhuman and degrading treatment or punishment, the right to respect for private and family life, the right to a fair trial, the right for freedom from discrimination and stigmatizations, the right to freedom of expression and freedom of assembly, the right to prevention, to treatment and harm reduction, and the prohibition of slavery and forced labor. And all these rights are guaranteed by the European Convention of Human Rights. So the field is quite big.
Thank you for this comment. I working with community for years, for each of this right, I could have, this is the violation, and this is story, and this is story. And I hope that with this changes and with new allies from the human rights activists from the UN, key UN mechanisms. When UN mechanisms have the report saying that current drug policy need to be transformed in something humane to prevent the violation of human rights, that gives us the power of a lot of experts in human rights and maybe the new allies for decriminalization and for drug policy reform. Saying this, I am giving the floor to Zavid, because that was about and he will summarize some issues, because the Office of Commissioner on Human Rights, UN Commissioner, they have all these issues in the report, so we could rely on it in every discussion about this.
Thank you very much, Dziękuję and Dobre. And I would like to also thank the organizer of the European Harm Reduction Conference for inviting the UN Human Rights Office to present, to come to this conference. And for me, this is the second time at the European Harm Reduction Conference. I was also at Prague conference in 2021. And also I would like to thank International Drug Policy Consortium as well as Euro-Asia Harm Reduction Association to organizing this panel discussion. What I was going to say, actually, almost everything has been said by either Elena or Catherine, Madeleine, and Victoria. So I'm not going to repeat, because I can see here few faces who have heard about speaking about this report many times. Last 1.5 years I have been speaking. For who you are not aware about this report, I have copy here. Please do collect at the end of this discussion. This report was produced by the United Nations Human Rights Office upon request from the UN Human Rights Council, which is based in Geneva. And they requested us to look at what are the human rights challenges in the world with regard to drug policy. So I would like to also take this opportunity to thank all of you who contributed in the preparation on this report, including on the panel, all of you have contributed, and also I can see on the audience few organizations who have contributed. And member state also contributed to preparing this report. In this report, we identify 7 challenges. All of them almost has been discussed here. I would like to repeat again. First is the lack of access to treatment, harm reduction, and services, health-related services. Second one is the prison overcrowding, drug policy. Impact of the drug policy result is the prison overcrowding, incarceration all over the world. We know this statistic has been given to many times that 20% of prison population is drug-related offenses in the world. In some countries, it's 80%. This afternoon, I was talking with Elena that in Philippines, it is 80% prison population is drug-related offenses. In many other countries, we have seen that. And then the issue is coming, the harm reduction, lack of harm reduction. And another issue within the criminal justice responses to use of the death penalty. I think Catherine mentioned that in her presentation, Harm Reduction International is monitoring that issue closely. And the report also look at the discrimination against vulnerable population. Within the vulnerable population, there are some intersectionality. The people who use drugs and people of African descent or colors. They are more being targeted. For example, in many countries, we have seen also Roma population, as you mentioned here, a colleague mentioned about the Roma population. We have noticed that Stop and Search, that program by law enforcement agencies who are being targeted, is mainly marginalized, vulnerable population there, and who use drugs, target against them furthermore. Then the issue of the gender aspect of the drug policies. Colleagues here, all of you mentioned that issue very closely. I don't want to report. But one thing I would like to highlight with Madalena mentioned about that drug policy and implementation of drug policy and gender context, the sexual and reproductive health issues also need to be discussed. And that is one of the neglected issue on issue in many countries we have seen. I would like to mention few other things just which has been discussed, but I think we need to address this issue very carefully, that civil role of the civil society. In our report, in many times, High Commissioner and others, even it is not only even system in the General Assembly. You remember the Angus outcome document, 2016. Outcome document, all member states agreed that participation and engagement with the civil society is key for developing effective drug policy. But as mentioned by a colleague here, Victoria and others mentioned that in this region, not only this region, many parts of the world, civil society who are working on drug policy, they are targeted by the authority many ways, whether criminalizing them for their work or harassing them, persecution against them, is we have noticed. And I would like to mention that people who use drugs, and so people who are actively involved to protecting their rights or providing harm reduction services, like all of you here, all of you human rights defenders. You are working to defend the people who are vulnerable. So you are human rights defenders. So we would like to treat from the UN system that to try to acknowledge that you are human rights defenders and what kind of protection could be given. In this regard, I would like to mention that one good example we have seen in the region recently in Scotland. I would like to mention that Scottish government has developed that Scottish Charter on the people affected by substance use, which will be launched on 11th of December this year. This charter was developed with the participation of the civil society, people who use drugs, community, and it provides all the protection which people who use drugs and who are supporting them, they need. I would recommend that, I think that promoting this charter around the different parts of the world, including this region, would be really useful. This charter, based on the international guidelines on human rights and drug policy, which also adopted with the participation of the people who use drugs, community advocates, harm reduction advocates, experts, and other UN experts and others as well. So that's tool, international tools, implementing at the national level, good example we can see in Scotland. I would like to mention that because one of the questions you have for me that how this international standard could be implemented at the national level effectively. The Scotland model is really, Scottish Charter is a really good example how to implement this international standard. One thing has been mentioned that more research needed. I do agree that research we need more, but I think that a lot of research has been done and a lot of information we have in hand, but lack of implementation, including this report from the UN side or Council of Europe and European Union. All these reports come out, we see the lack of implementation. And that needs to be strategized with the participation of the civil society, community, and others, and how we can move forward. And with that note, I don't want to take too much time. I would like to mention in this regional context, as Dennis mentioned, another tool I would like to highlight, which is also based on the international guidelines, that is self-assessment tool of the Council of Europe Pompidou Group, which is developed on the basis of the international guidelines. And for example, in the context of Italy, you mentioned, Madam, the new law is coming. maybe this law need to be checked with the self-assessment tool, whether it goes with that, what are the gaps there, how those gaps could be implemented. In this regard, already Elena mentioned that there is mechanism, but we'll be happy to, from the office, to look at the law and provide guidance to the civil society and the government that way. I think I don't have. There is one question from the USA, colleagues from USA. Yes, this is a really good question. What we are doing at the national level from the UN side, and also the donors' relationship to that question. I would like to give you one example. After George Floyd, when he was killed by the law enforcement officials, you know that all over the world, there was a movement started. And then United Nations did, from our office, we did a big report, and that report was presented to the Justice Department and the State Department. And some changes we have seen after the report has been published, and specifically giving instruction or recommendation to the US government what needs to be done with regard to law enforcement and racism. And this issue, law enforcement and racism, we discussed yesterday in the law enforcement. It is very much connected to drug-related issues, drug situation. And the report recommendation, after sharing, government has taken some step, and state government as well, not only federal, but state government, some state, but those steps which has been taken, how to continue in the new context. Next year, context will change, and how to continue those implementation. I don't want to go details on the recommendation. The recommendation include the racial composition, to look at the racial composition of the law enforcement agencies and address that issue. It recommends the reparation. We didn't discuss this issue in the context of drug policy, and after human rights violation, which is happening, or reporting and all this, there is a really important aspect we need to address, addressing the impunity and providing effective remedy to the victims, that one. That we don't discuss that much, actually, but it is one of the issues that civil society, like your organization, producing the report and all these things, but we need to raise this issue, the impunity. When there is any violation, whether law enforcement or health officials, health workers, what kind of accountability, or prison officer, what kind of accountability we can think about or we can pursue, as well as remedy. With regard to accountability, I would like to mention what happened in Philippines. This was absolutely horrendous. And now International Criminal Court even investigating the human rights violation, extrajudicial killing or extrajudicial measures which has been taken. They are investigating. Hopefully they will formally initiate the case, that one. With that note, I will stop. We don't have time.
Thank you. I guess that was rich discussion, and hopefully we will not only document the violations, but also address this, like prevent violations of human rights, like we did yesterday, working with the judges, prosecutors, and law enforcement high officials to discuss how it could be prevented and how this huge system could be humane and open to changes and supportive in the public health area. And we together with all these partners, we continue working on this. If you want to know details how to make submission to UN treaty bodies, in 30 minutes we're starting in specific room which called KISS. So come to KISS us. And on this moment, I want you to gratitude and to thank our absolutely amazing panel for work they are doing every day for human rights protection and for this presentation. Thank you very much, my dear colleagues. And thank you, interpreters. It was not easy. Let's go. We could have coffee. And there is the exhibition on the 4th floor, and there are criminalization cost maps from us. You could take one map and have the picture of the criminalization costs in your